Hi, my name is Zachary Ernst. I'm a second-year medical student at Oklahoma State University Center for Health Sciences. This study was led by Matthew Farrell. Co-authors include Sydney Farrell, Dr. Jaswell, and Dr. Matt Vassar, and this is titled Effects of Statin Therapies on Individuals Taking Antipsychotics, a Systematic Review. So the majority of the patient population that we studied within the six included studies were diagnosed with schizophrenia, but they all had severe mental illness because the goal of this was to look at the effect of statin therapies on patients taking first or second generation antipsychotics. And we know that individuals on antipsychotic medications are at a high risk of developing dyslipidemia. And so a paper that was done in 2014 looked at the effect of statin therapies in patients that are taking antipsychotics and did find clinical improvement in LDL-C as well as total cholesterol. So we wanted to provide an update to those findings, and we also wanted to look at BMI, blood pressure, or any safety concerns. We began this study back in August of 2022, where we searched Medline, Embase, PsycInfo, PubMed, and Cochrane Central Register of Controlled Trials for studies pertaining to the effects of statins on lipid profile measures for those taking first or second generation antipsychotic medications with a diagnosis related to severe mental illness. Data extraction was performed in a masked duplicate fashion, and based on article type, each study's risk of bias was assessed using Robbins 1 or Robbins 2. The grade criteria were used for certainty assessment. Okay, so here's figure 1. This is our Prisma flow diagram, which shows our process of study inclusion and exclusion. Over here shows our exclusions with rationale, and we ended with 6 articles from which we extracted data. Okay, and then here's table 1. Here's our 6 studies. Of our 6 studies, we had 2 prospective cohorts, 2 retrospective cohorts, and then 2 randomized controlled trials. Here we've got the number of patients listed from each study, and then our results over here are just showing baseline HDL and then post-treatment HDL after statin therapy. This goes on for LDL, as well as triglycerides, and then total cholesterol. And so our initial search, we started with 396 articles. We ended with 6 that were included. And so 5 of those 6 articles identified significant change between baseline and post-treatment lipids. Of the articles recording blood pressure, BMI, or weight, and significant safety concerns, no significant changes were found. The certainty assessment for this systematic review is rated as moderate. And a meta-analysis was not performed just due to the heterogeneity of data from these studies. Okay, and in conclusion, patients at risk of developing dyslipidemia secondarily to antipsychotic treatment for a severe mental illness should be considered for lipid-lowering therapy with a statin. For this specific population, studies showing a significant reduction in LDL-C with statin therapy demonstrate the utilization of statin as an appropriate prevention and treatment for dyslipidemia and its related cardiovascular risk. These studies showed no significant association between statin therapy and BMI or weight changes. Therefore, we recommend providers counsel patients with alternative mechanisms to manage the specific side effects antipsychotic treatment may have. Additionally, these studies yielded no significant association between statin therapy and safety concerns, thus providing an option to manage this population's dyslipidemia without cause for major safety concerns. For any questions or concerns, please contact me at ernst@okstate.edu, and thank you for your time.